here with Women of Community's Take 10 series, a video series, each episode under 10 minutes, and it elevates and celebrates a woman of color working for the health of her community. Our guest for episode 3 is Fran Ayalasomayajula, a public health and technology strategist who's passionate about patient-centered, evidence-based digital solutions. Fran is the head of digital health strategy for HP worldwide, where she works to influence technology for population health in really critical areas like AI, hospital in the home, and digital therapeutics. Prior to HP, Fran has worked for some major public health organizations, including the World Health Organization and the CDC. She's written several publications on technology-enabled population health management. She's also spearheading a national advocacy campaign called Save Moms, which is working to eliminate all avoidable maternal deaths. Whew. That is a lot. And if that's not enough for you, she's also the founding president of REACH, a nonprofit global social impact organization. All right, let's bring up Fran now. We have tons to talk about. One second. Fran, thank you so much for taking the time and letting me interview you today.
Yeah, Shruti, I'm really excited about the conversation. Thanks for having me.
So you've had a 20 plus year career at the intersection of public health and technology, and you've been really successful at driving evidence-based digital health. But tell us, who are the communities that you serve and how are you supporting your people?
My purview is global. So I tend to have initiatives that span across the world. We've done some programs on maternal mortality prevention as far reaching as India. We've been engaged in studies that have looked at the application of digital health in the UK and other parts of Europe. We also have programs that we've done right here in my own backyard of in California. Just in a lot of work in a variety of environments.
I mean, you've had such an incredible career. Of course, I know that you didn't start where you are today. Can you tell us, what has your journey looked like with examples of where you've taken some risks or how to break some rules to get to where you've gotten to?
Where I am today was not as if it was something that I planned for. And that's probably quite obvious because digital health is something that has evolved over the years. When I started off really focused on international development. I started with USHUMBA, the U.S.-Mexico Health Association, and with PAHO, the Pan-American Health Organization, which is the section of the World Health Organization that's focused on the Americas. Even though my background is in public health and epidemiology, I was utilizing a lot of the statistical applications in my role. It just so happened to be that I entered into my career at a time when the industry really didn't have a lot of professionals who had experience in both the clinical and healthcare side, as well as the technical side. I think the big things for me were, number one, that I didn't, quite frankly, say no to any opportunities. When something came my way, I took the opportunity. And the result of that was by not sort of pigeonholing myself and defining what it meant for me to be in public health. I didn't end up spending the majority of my career in state departments or departments of health. I've worked for very large corporations. I've worked for government. I've worked for NGOs. So I've just, I've had an opportunity to get a feel for it all, and even have done quite a bit of work with startups. I just kind of insist on taking on opportunity and not being willing to let somebody else define what it is I'm able to do because, my background is in one area or another.
I'd love to hear more about REACH. What inspired you to start REACH, and what are you focused on with REACH?
I'm so glad you asked about that. So REACH is really amazing. The principal or parent company is called I Belong. Now, I Belong is a 501c3 non-profit. I started it about 6 years ago, and it was really centered around wanting to do things directly within the community, helping people find paths to wellness in ways that were convenient for them, and leveraging unconventional environments. Like I would use the library. I mean, number one, it's free. And number two, it's easy for people to get to. So that's how I sort of started off. And from there, it began to evolve. I feel like when I look at a lot of the problems we have in the industry, it's so easy for us as professionals to blame the healthcare consumer. We have so many persistent challenges that are in fact not the problem of the patient. They're actually problems of our own creating a creation. We just quite frankly could do better. And that's what Reach started off as. So it's been amazing. We have clinicians from all over the world. We have about 4 continents and 7 countries being represented. They're all from major institutions. They're all 100% volunteers, giving of their time to do this good work.
You should definitely check out the website for Reach, linked in the comments below. And I love that because you're the head of digital health for HP, a large tech company. And then you, again, took this opportunity to start Reach. And it really does speak to your journey in your career overall and how you your passion for public health is driving you to take these risks and these new opportunities as they come. You got critical sponsors like Google, HP, Microsoft to support you.
Well, thank you. But Shruti, I have to be completely transparent. So what does that sponsorship look like? Sometimes we take for granted the opportunities that are presented to us. For example, with Microsoft has this program for non-for-profit organizations. And I went through the process of qualifying for that program, and I'm leveraging the tools. I'm trying to exhaust every tool, every resource that they make available through that program. My way of thanking them for making that available to me is by showcasing them and acknowledging them on my site. I just want to be clear to those viewers that it's not always going to be a giant check that somebody's writing for you.
You're calling attention to something else that's really important. If you want to be an entrepreneur, and that can mean a lot of different things, entrepreneur, but it's basically trying to start something and move something. You have to think really creatively of how you are able to launch, execute, drive, scale, all these different things. So thank you for calling that out. So we're going to name some names now. Women of Community is all about elevating and celebrating women of color working for the health of their communities. Who are the women of community in your life that you would like to give a shout out to?
I've met the most incredible women from all over not only the country, but the world. But I would have to shout out today to Kiwoba Alaire. She's in the Bay Area. She has a program called Girl STEM Stars. And the work she's doing to make sure that young girls are exposed to STEM and not including health and life sciences, and giving them the opportunity to see what it's like and to shadow people, right? And to define new role models for themselves, I think is so applaudable. And the second one I would say is Aisha Junan. Dr. Junan is phenomenal. She leads the Yemen Relief and Reconstruction Foundation in an area that has been war infested for so long. I mean, she's just incredible.
For those watching, if you'd like to learn more about the amazing women that were just given a shout out, check out the comments for links to more information to them. All right, Fran, I want to spend all day with you because you're amazing. But last question, sadly, our time is up. For people who would like to support you and the work that you do, what's one actionable thing they can do?
Become a sponsor. Go on, visit our website. We do a lot of activities. We've got research initiatives happening. We've got a major program called the National Save Moms. All of these programs don't happen on their own. There are some real hard costs associated with them. And we would love to have you support us, whether it be financially or as a volunteer. And lastly, I would say, listen to Reach Radio and like the show.
Fran, thank you so much for taking the time to be here. You're an incredible human. Not only are you the head of digital health for HP, but you are the founder of Reach, doing incredible, amazing work. And I just feel very lucky to have you on this show.
And I'm lucky to be here. Thank you, Shruti.
And to the audience, thank you for watching. We really appreciate your support here at Women of Community. Please comment below and let us know what you think about this episode. Thank you. Bye, Fran.
Bye. Thanks.